Please invite your friends and family groups by sharing this link to watch the show and make yourself aware on another new topic. Let us start our day with invoking blessings of the Almighty, and for that, I would like to invite our senior health educator, Yogesh ji, to do the morning prayer. Yogesh ji, over to you.
Thank you, Vibhaji. Good morning, everybody. डॉक्टर के अग्रवाल सर की दिव्य आत्मा को नमन करते हुए आज फिर से हम ऋग्वेद के एक मंत्र पढ़ेंगे जिसमें विद्या दान की प्रार्थना की गई है भगवान से और विद्वानों से। शचीभिर्नः शची वसु दिवा नक्तम दशस्यतम मावाम रातिरूप दसत कदाचनास्मद्राति कदाचन। हे सद्बुद्धि का वास कराने वाले विद्वानों, आप दिन और रात में कर्मों से हमें विद्या प्रदान करो। आपका विद्या दान कभी नहीं नष्ट हो तथा हमसे दान भावना कभी नहीं नष्ट हो। इसका भावार्थ है, सुख के अभिलाषी मनुष्य को विद्वानों से विद्या ग्रहण करनी चाहिए तथा उस विद्या को अपने संतानों, शिष्यों और सब मनुष्यों को प्रदान करना चाहिए। विद्वानों के सत्कार, सेवा तथा धन और विद्या के दान से ही विद्या की रक्षा होती है। इसका काव्य रूपांतरण भी बोलता हूं। हे विद्वानों, सकल विश्व में सद्विद्या को फैलाओ। विद्या दानी नष्ट नहीं हो, दान करो यह समझाओ। धन्यवाद। Over to Vibhaji.
Thank you so much, Yogesh ji, for this wonderful and meaningful prayer this morning. आज आपका जो ये प्रेयर था वो हमारे इस मंच को पूरी तरीके से एक्सप्लेन करता है. Thank you so much for the dose of positivity to start our day with. Awareness is like sun rays. The more it is, the more illuminated our lives are. It is the biggest agent for change. The more we spread awareness, the more we bring about a positive change that makes a society better informed and progressive. Illuminating us all again on request, today Dr. Meenal Shah is with us and she will shed some light on a new topic, that is postural deformities. Posture is the form of our body which is made up of proper positioning of bone, joints, muscles, and nerves. Posture gives us a proper shape and defines our personality as a whole. However, if there are certain defects in the posture, it can affect our health in many ways. Though Dr. Meenal is very familiar to our platform, but for the people who have joined first time today, I would like to introduce her. Dr. Meenal is a young and dynamic physiotherapist from Mumbai, who is an HCFI member too, and who believes that movement is medicine and strives towards providing the latest and improved pain management for patients. I extend a very warm welcome, Dr. Meenal, on Health Darbar, started by Shraddheya Dr. KK sir, and I request Dr. Meenal to tell us all in detail. Over to you, Dr. Meenal.
Good morning, everybody. Thank you so much, Vibhaji, for having me again over here. It has been a great pleasure. Today, I want to talk about what is posture and how it affects your life and what is its significance. This session will not be targeted towards teaching you exercises because no one size fits all. The session will focus on making you aware of picking up the cues of what is deviant from normal about your posture and how you can optimize it to your maximum benefit. Okay, I will just share my screen and we can get started. Today's session is a little short, but we will still be left with about 5 or 10 minutes in the end for questions, which I'll be more than happy to answer. Is my screen visible to everybody?
Yes.
Excellent. So common postural deformities and how you can avoid them. This is a basic disclaimer. This is a presentation for education only. Please do not use this for any medical diagnosis or replace it by a professional advice from a qualified healthcare practitioner. Please be mindful, this is only for your knowledge and this cannot be used for any diagnosis or any conclusion. Okay, so what is posture? When we think about it, we will always think of some kid standing in the school assembly, standing straight in front of a teacher because that's what they've been told, or reminding yourself while looking at your PC that, oh, I have to roll my shoulders back and sit, only to slouch back down in the next 5 minutes because that's comfortable for us. So, ideally, posture is how your body holds itself in space against gravity, how your body uses its own forces of its muscles, joints, bones, ligaments to counteract the gravitational forces to hold itself in place to do the tasks that you need to do. Now, posture, when we think about it, it is usually like standing still or sitting still. But the truth is, posture is a very dynamic term. You could have a specific posture when walking, you could have a specific posture when running, you could have a specific posture when sitting. So, posture is broadly divided into static or dynamic. Static is where you're stationary, dynamic is where you're moving around and doing the things that you need to do. It is also essential to notice that both of these form a great chunk of our day to day life. So, you need to be able to handle the forces which the gravity is putting on your body by having an optimal dynamic or an optimal static posture depending on what the activity demands out of you. Now, what determines your posture? Unfortunately, there is no one size fits all over here. It is all customized. Your posture will depend on your structure, the size of your bones. Often, people with really long and slender bones have a slouchy posture. It will also depend on whether you have an injury, whether you're pregnant, whether you have a lifestyle disease, whether you're undergoing a surgery, whether you're planning to have any modifications in your body. According to that, also your posture will change very dynamically. Again, static and dynamic living patterns, sedentary lifestyle versus someone who works on the field or versus someone who has a more hands-on job, your postural differences will be very, very different. Also the psychological state, the days when you have a party to go to, you would have such a good posture throughout the day. Your shoulders will be rolled back, you feel better, your chest is puffed up. But the days where you've had a fight with your boss or your relative or your spouse, you're just slouching, you're grumpy, you don't feel like talking to anybody. So even your environment greatly affects your posture. It's never only an injury, it's never only bad footwear, it's never only a bad position of sitting. There are a multitude of reasons that your posture can take hit at. What is a perfect posture? I'm going to break this and this is not going to end well, but there is no such thing as perfect posture. If that's what you've been fed, I'm really sorry. You have to break the myth. There is no such thing as a perfect posture because if something fits for someone, there is no guarantee that it will fit for you. The basic definition of good posture is you give the least amount of strain to get the maximum amount of work needed from your body. So here, when we think you have to be in perfect posture, we yell at kids कि नहीं सीधा बैठो, bag ठीक से पकड़ो. The perceived importance of posture is huge, but the actual importance is very, very, very less. So if someone tells you आप सीधे नहीं सोते, pillow लेके सोते हो, just say yes, listen from this ear, get it out from the other ear. There is no perfect posture. I'm sorry to break your bubble, but there is no perfect posture. Now, all these four ways are good ways to sit. Even though she's slouching, but she's comfortable. That is what I could sit straight. You could keep your hand straight like this for 30 minutes and it is going to hurt. But according to postural guidelines, it's the right thing to do. But that's not practical. We need something that works for our body. We need something that keeps us comfortable and not puts you in a position. You're not a guard at the Buckingham Palace. You have a multitude of things to do, and your body needs to support that without being under stress. Okay, so the key to good and bad posture differentiation is how long do you spend in that one particular position. You could be sitting slouching for 30 seconds, it's not going to ruin your spine. You could be sitting straight for 30 minutes, you could have a back pain because of that. So the timing is very, very important when you are ascertaining a particular posture or a way of sitting or walking or whatever activity you choose to do. Now, what is a good posture? Again, there is no perfect way to do this. This is going to be your own recipe according to what works for you. So each person usually adopts their own method of sitting and own habits of sitting depending on what is comfortable for them. And ideally, our spine has four curvatures as you can see them. There are two convex and two concave curvatures. There is cervical and lumbar, which is the inner C that you see over here and on your lower back. And there is thoracic and sacral. Sacral is your tailbone. Thoracic is right behind your rib cage. Ideally, you would want to maintain all these curves. You do not want to sit straight all day long. It's not practical. It's completely unnatural. You want to maintain these curves when you're doing your activities to have the least amount of work being done by your body to get the greatest amount of work done. Now, you can just take a screenshot of this slide because this is what a basic posture should look like. Where your pelvis is neutral, your entire basin of your pelvis is sitting in its place. Your entire foot is on the ground. Your joints are stable. You don't feel like you will fall down. You don't feel like your knees will give way or ab gir jaoge. Your abdominals are tight. Tight as in it shouldn't feel like someone is pulling it. They are in place. They shouldn't flop around. They shouldn't make you want to go back or go in the front. Your ribs are upright, your shoulders are retracted. Now when I say retracted, don't do this. Your shoulders are in its place. You can see the woman in the picture. And your ears are over your shoulder. These are just cues. You don't have to sit like that all day. This is just a mental cue to tell yourself where to keep your body segments. Now, what are the benefits of good posture? I think everybody knows that. I will not go very deep into it. But some of the things that really stand out for me is when you have a good posture or when you try to maintain a good posture, research has showed that it improves your mood, the level of your anxiety goes down, you're way more confident, you are way more clear in what you want and how your work goes about. And also you are very your posture, because your posture is better, you're able to execute tasks better because you don't have to worry about what will hurt next if I don't sit a certain way. Also, your digestion improves greatly when you make sure you are in an optimal posture. So, what is a bad posture? There is no such thing as a bad posture. You could sit like a snake with your legs in the air. If you're comfortable, that's okay. But do not sit in that position for a really long time. The only deciding factor between a good posture and a bad posture or a harmful posture or a non harmful posture is the length of time that you spend in that particular position. What are the most common postural deformities seen? So these are the basic deformities. They obviously have their deviations, but I will be showing you pictures of all of them so that when you see it in public or when you see it in a patient, you can pinpoint it out and say that, okay, maybe you need to see someone and get that checked out. So flat feet, as we all know it, your arch falls down. This is what your foot would look like. Uh, this usually happens because of multitude of reasons: bad knees, bad footwear, footwear which are too tight for you, if you have footwear with bad heels, if you have footwear which is worn out. Footwear dictates a lot of how the entire kinetic chain from ground up works for you. You could have headaches from bad footwear, all because of a bad posture. Then you have your knees, which could either be bow-legged or knock knees. This usually is very prominent in adolescent kids. You will see their knees form either like two bows or they knock each other. They're either called grasshopper knees or you can call them knock knees. So where you can see the femur have gone in and the tibia is sort of going out. So what happens is when you walk with your knees like that, the forces that your body has to generate to propel your body forwards increase. So the work of your legs increase. And when that happens, you're spending more energy to do the little amount of work that you have to do, which is why postural correction exercises are required. Okay. Then you have the anterior pelvic tilt. This is very commonly seen in females, especially pregnant women or anyone who is heavier around their mid area. You can see that the belly is pulling the entire pelvis in the front. And because the gluteal muscles are not strong enough to keep it in place, it is going forward. And you can see how the spine has this extra curvature compared to the neutral pelvis. Now this is something you will see either on an X-ray or on a bare spine or on without clothes. Otherwise, with clothes, this is a little difficult to see unless it's very prominent. You have lordosis, like we saw before. You have an exaggerated lower back. You could have kyphosis, where your thoracic spine is way more curved. It'll feel like the person is having a C or a hunchback. Scoliosis is when one side, your spine deviates on one side. It could be left or the right side. The main cause of this is muscle imbalance. The muscles on one side are tight, so they pull the spine towards one side, and the muscles on the other side are weak, so they go towards the stronger side of it. Then you have the forward head posture. This is seen in about 70% of the population because we are primates. We use our hands to do everything. We're constantly using our hands to write, cook, type, everything. So when that happens, all of these muscles take a brunt of it. And then this is what you feel like. And if you saw yourself from the side, you will realize that everyone has some amount of a forward head posture. That's normal as long as it is not giving you pain. So what can we do about these postural deficits? We know what could go wrong. We know what can be done. So, movement. The only way you can fix the deficits is movement. Because every time you move, you will be breaking that 15 minutes of being in that posture. And always remember, best posture is your next posture, which means we expect you to keep moving every 15-20 minutes and remind your body that, okay, your job is to move and that's what I'm giving you. Now, these are some basic tips and tricks. I have put it in two sections. The first one is a workplace and the second one is a kitchen, which is, I think, majority of the population looking at this right now. So these are some very basic pointers to remember. Now we all remember that photo जो हमें office में दिखाते हैं कि ऐसे बैठना है, straight बैठना है, ऐसे desk होगी. But nobody tells you why ऐसे बैठना है, okay? And it's not practical to sit also as a straight 90 degree. You are not a stick figure. So the first thing, very important, which people usually miss is resting your elbows. What happens is when you're not resting your elbows, your shoulders and your neck are doing the work of supporting your hands. If you are on a chair right now, try typing on your keyboard with resting your elbows and without resting your elbows. You'll be able to notice the difference. I often tell my patients that if you cannot find a chair with an armrest, get a table which is big enough that you can put your laptop at the end of it and you can rest your elbows on the table. If you've had a very long, difficult day, what do you do when you see a table? Do you rest your elbows first or do you bang your head first? So it is involuntary in us to do that, but we often forget it when we try to look for the perfect posture and sit in 90-90. We don't want that. You have curves, use them. Footrest, very important. It is okay to dangle your legs. It's a very relaxing activity. If you have the luxury to do that, excellent. If you don't, find a footrest. Make sure your hips are higher than your knees. It has to be an incline downwards and not upwards, okay? Again, like I said, hips should be higher than your knees. After that, get as close to the desk as possible. Don't go all the way back and try to do this. It's unnatural. Your elbows are going to hurt. They're not going to be supported. Your neck will have to do all the work. Then you will go into forward head. then the neck will hurt. Because the neck will hurt, neck ke niche kya aata hai? Thoracic spine. It's a kinetic chain. If one muscle gives up, the next muscle takes over the work. If the next muscle gives up, the muscle below that takes over the work. So never think कि मुझे neck problem है तो पैर में कुछ नहीं होगा. A lot of times neck problems are solved by good footwear. So your kinetic chain is constantly working. It is up to you how you tweak it and how you use it to your advantage. And again, like I said, remember your spine has curves. Don't try to become a stick figure. That's not your natural form. Base of the chair needs about 5 legs for stability, but 4 is fine, whatever is available. Again, the infamous picture, but now I want you to look at it with a different perspective. Here he does not have an armrest, but ideally I would want you to have an armrest. Here you can see the screen is far, far away. So this is a quite wrong picture. So you guys can figure out what is going on. I also want you to notice that there is no support for his mid back. His mid back is in the air. If he went back, he could easily fall back. It is not extremely necessary to support your neck. It's okay if you cannot get an ergonomic chair, but always make sure your lower back is supported because that takes a lot of work when you're sitting. I'll show you a more corrected picture now. This is a way more corrected picture. Can you see the correct sitting position? His elbow is rested. His mid back is rested. Lower back is also rested. It looks like he is at a 90-90, but he is not. Okay. And your screen has to be eye level according to your spectacles, not according to the general eye level. Wear your spectacles. See what optimizes your screen. And every time you squint, that's not the position for you. Find a position where you don't have to squint, where you leisurely open your eyes and you can easily see your screen. Also, standing and working is another thing I advocate a lot because I think one, keeps your blood flowing throughout, keeps you on your feet, you think better. Because you are in an upright position, you're sort of in the work mode. You get work done faster is what research has shown when you have a standing desk. Even here, see, he is trying to make sure his elbow is supported. But if I were there, I would have made sure the table is a little longer so the elbow is supported. Whenever you're sitting, you could be sitting on a sofa, you could be sitting in a car. Just make sure your elbows are supported if you have neck issues and shoulder issues. That is your holy grail to make sure no strain is put on your neck and your shoulders in absence of a backrest or a neck rest. Now, these are posture-friendly hacks for the kitchen. Everybody watching right now, I'm sure you guys have issues with, I cooked for 20 minutes and now I cannot go further. I don't understand why it is still a wild concept that you can have a chair in the kitchen. I don't understand why people still think they have to do everything standing. I really urge everybody watching this, please make an investment or take one of your dining chairs and keep it next to your stove. When the food is cooking, you don't have to be standing. You don't have to put pressure on your knees, ankles, hips to look at it and stand. You know 5 minutes tak cook hone wala hai. So sit down. It's okay. You don't have to be standing. So one, keep a chair handy in the kitchen. If you feel like you are bending down too much, get a platform. Get something that gets your work to your level where you don't have to bend down. You can see here where the woman is working, her elbows have not straightened. Her elbows are still slightly bent and very relaxed. People who work in the kitchen will realize कि कभी-कभी कोई काम करने के लिए they have to like really bend down for a really long time. But when you find yourself doing such an activity, either take a big box or something and keep your task on top of it and then do it, or transfer the task to your dining table where you're more comfortable. See, kitchen work is something that is going to go on for a really long time. And if you want to do it optimally, I feel like these small tweaks and hacks will help you do it more easily and more efficiently in the long run. Very important, posture-friendly hacks for lifting. Now, lifting is not just a box. You will lift your grandkids, you will lift your laptop bag, you will lift things off of the floor. There are so many things why lifting is important. Box is just an example so you understand where we're coming from. When you see a box or a load, please don't feel that ha main utha lunga. Think about it. Maybe, push it a little bit with your leg. Try to understand how heavy it is, get a feel of it, and then try to go and pick it up. Plan your lift. Go around the box. See where you can lodge your hands and pick it up so you don't injure your fingers, wrist, or your elbows. Think about how you're going to lift it up and always stand behind the box. Once you stand behind the box, make sure you anchor your feet to the ground, bend your knees, pick it up. Keep the box as close to you as possible. You know how back in the day women used to keep babies over their waist? That is the best way to hold your baby, grab them without feeling any weight on your body. They could lift such heavy weights because they would keep the baby closer to their body. If you see women even now, when they lift huge pots of water, they will keep it as close to the body as possible. This makes lifting easier. It transfers the forces right back down to the earth. Take home message, very simple. Be mindful of your posture during everyday activities like watching TV, washing dishes, walking. Keep a chair around you if you need it. Do not constantly stand. Always keep moving. Stay active. You could pick an activity that you like. It doesn't have to be walking, it doesn't have to be running. It could be anything that you like, but make sure you have one activity which makes your body move throughout the day. Maintain a healthy weight. Every time your weight increases a little bit, your center of gravity moves from your lumbar spine to further ahead, which makes your body want to try to catch the center of gravity. So you start losing your balance and your posture takes the brunt of that. Third is wear comfortable and low heel shoes. So research has shown that when you wear shoes with really high heels, your calf muscles sort of shrink, and there is no way to let them go back to their original length. So, similarly, when you have faulty shoes, there are a lot of things that go wrong, which are not directly visible to the eye, but you can see the effect of it in your activities. Also, make sure work surfaces are at a comfortable height for you. Like I said earlier, kitchen, workplace, whatever needs you a flat surface, make sure you are comfortable using it at your height. We are open for questions now. Please go ahead. Here, do we have questions? Yeah.
Vipaji, you are in mute.
Yeah, sorry.
Yeah, I think we have questions here.
Yeah.
Okay. That long wine chair is perfect for kitchen. Shivani ji, I don't know which wine chair you're talking about, but if the one with the really small back support, no, that is not safe. There's a very high chance you would fall back down. It doesn't have an armrest. It does have very small, fancy looking low back patch or a panel. No, it's not perfect for the kitchen. You can get a basic stool for the kitchen. You don't have to get fancy. Get a basic stool, basic Neil Kamal plastic chair. Perfect, good enough.
Dr. Meenal, this is a question from Dr. Helgald, that from Facebook.
Oh, okay. Okay, all right.
I forgot to put his name.
Sure, no worries.
So there is one more question
how
from
can we know early the deformities that may come? Excellent question. So when I said about the knees, usually they show up in the adolescents. When you see the children walking in a faulty way, when you see the children complaining of pain, those are the things that you start seeing in the adolescents. But these are postural things, are something you need to keep inspecting regularly, because every day is a different day. Every day your stress is going to increase. Every day you're going to have new responsibilities. Your body reacts to those things. Now, I'm not going to sit here and tell you कि अरे पहले के ज़माने में लोग बहुत काम करते थे. No, we are in today's zamana. Let's act like it. Let's figure out a way to tweak today's zamana for our benefit. So पहले के लोग activity करते थे, perfect. But today, how do we use this to our benefit to aid our sedentary lifestyle and also make sure we don't ruin our bodies or ruin our joints? That's the whole point of this. And making sure that your posture is optimal and not perfect. Please don't fall into the whole perfect posture, sleeping straight, standing straight, you're just causing more damage. Okay, there's one more, I think. What do I do when I'm duty? Timing is from 10 to 5:30. Priya Mishra ji, that's when you start taking physiotherapy, you start strengthening your muscles, due to which the pain goes away and you can resume going back to work. You should consult someone. Kalpana Sardan, does flat foot alter? Of course, flat foot does alter your posture. However, it's in different degrees in everybody. Some people live all their lives with a flat foot and see no differences whatsoever. Some people see a 5-degree difference and they start having back pain. You need to get evaluated. Like I said, it's not DIY, it's not one size fits all. You will have your customized plan and your body will have its customized needs, which I'm sure your doctor will be more than happy to cater to.
But Dr. Meenal, I have seen people who are having a flat foot and they start getting pain in their ankle.
Yes.
Yeah, so I think for that they need some special kind of footwear, or what is the way to get rid of it?
There are two ways to do this. Flat foot can cause back pain due to weak hips. So there are some cases where you could strengthen the hip and get rid of the pain, and the flat foot still remains and does not cause any hindrance. The second way is to get customized insoles to see where the body is putting faulty pressure. So we sort of give them insoles and some gel supports depending on wherever it is needed in their foot. And then that eventually gets rid of the pain. It's not an overnight thing. Dealing with flat foot goes over 3, 6, 9 months.
And can it be corrected?
Absolutely, 100%. Yes.
Even knock knees also?
Knock knees depends on the degree that you have it. If it's less than 15 degrees of deviation, it can be fixed without surgery. Otherwise, you would require surgery.
And till what age it can be corrected?
About 21 to 22, because after that, again, the growth spurt stops around that time. That's when you can get it corrected. Because anything before that, you will keep seeing more and more bone formation, leading to more and more deformities in a wrong direction.
Okay, thank you.
Welcome.
There is one more question. Ear over shoulder, put more light on this.
Sure. So ear over shoulder is just a cue. So when you stand straight with your shoulders rolled, sorry, I said I don't mean stand straight. When you stand optimally with your shoulders rolled back, if you notice, your ear goes over your shoulder. It's just a cue. It is no instruction. It is just a cue. That's all.
Okay. I think there is no more questions here. If anybody else has to ask, please ask the questions.
Shivani.
Dr. Meenal, I wanted to know, this flat foot is by birth? Or
Depends. It can develop over time. It can show up with birth. It's different for everybody.
It is different for it.
Mm-hmm.
Thank you.
Okay.
So I think there is no more question, Vamsaj. Please unmute.
One second, I'll read the question that is put by Arjit Singh ji. Little linger walk, then 40 to 50 minutes gives pain just under below my left knee and turns fine after long rest. Is it now or knee problem?
It could be a knee problem. It could be an ankle issue. It could be a hip issue. It could be the surface that you're working on. So many things. I would have to examine your knee, ankle to come to a conclusion.
Sure. Vibaji, we can.
Yeah. So Dr. Meenal, I think there is no more questions, and I'm sure everybody must have experienced that posture doesn't matter unless until you are not getting pain. As Dr. Meenal said in her talk, that best posture is your next posture. So which clearly indicates that don't sit in one position for longer time. Keep tilting, stretching, and moving in between. Go and have a glass of water and tea and coffee. Use your washrooms, which is an extreme end in your office or home, so that you can move.
I will start saying that to my patients. That's
Yeah.
a good one.
Move little more. And the most important thing, please ensure that your sitting desk is proper while you are working in the kitchen. Your platform should be on your level, and keep your one chair in the kitchen so that you won't feel tired, and your legs are comfortable. So thank you so much, Dr. Meenal, for this wonderful session and breaking the myth on ideal posture. With this, I would like to once again thanks Dr. Meenal for drawing our attention to something as basic, as vital as posture. And I also thank all the people present here and joining us on Facebook and YouTube. Your feedback and suggestions on topics are most welcome. And please, I will request you all to like, share, and subscribe and watch this again and again. This is not a simple two-liner information. For that, you need to watch this again and again and take benefit.